Have you been wondering whether you should sign up for Part D or how and when to enroll in Part D? If so, you are not alone. Part D can be one of the most confusing Medicare programs for many people. Hi there, if we haven't met yet, I'm Danielle Kunkel-Roberts, co-founder here at Boomer Benefits and a member of the Forbes Finance Council. In this video, I'll explain what Part D is, why you should consider signing up, and how and when you should enroll to avoid paying any late penalties. Medicare Part D is a voluntary prescription drug program that helps you reduce the cost of medications that you pick up at the local pharmacy or order via a mail order program. Part D drug plans are offered by private insurance companies in each state, so you won't sign up for Part D at the Social Security office like you do for Parts A and B. You are eligible to enroll in a Part D drug plan if you live in the plan service area and you're first enrolled in either Medicare Part A or B. There's no health questions asked on a Part D application. Everyone on Medicare is entitled to enroll during a valid enrollment period. Now let's talk about when to enroll and why. Your initial enrollment period for Part D is the same 7-month window as your initial enrollment period for Medicare. It begins 3 months before your 65th birthday month and ends 3 months afterward. This is when most people enroll in Part D unless they have other creditable coverage from an employer or a source like the VA. While technically Part D is voluntary, no one knows when they will get sick and need expensive medications. So Medicare encourages your enrollment at age 65 by imposing late penalties for late enrollment. If you do not have other creditable drug coverage and you miss enrolling during your 7-month initial enrollment period, you will start accumulating a penalty that gets larger with time. The penalty accrues at 1% of the national average premium per month for every month that you could have been enrolled in Part D but were not. For example, let's say you decided not to enroll because maybe you aren't currently taking any medications or your medications are just really inexpensive. If you were to wait 5 years to enroll, you would then pay a 60% higher premium as your penalty, and you'll pay that penalty for as long as you remain enrolled in Part D. Fortunately, there are some very affordable drug plans in most states, so even if you don't need the coverage right now, you can enroll in an inexpensive plan so that you have coverage in case you need it, and also so that you don't begin accruing that late penalty. Delaying your enrollment is risky because once your initial enrollment period passes, you can only enroll in Part D during a valid election period. Medicare gives all beneficiaries an annual election period each fall from October 15th to December 7th to join a plan that will start the following January. If you skipped enrolling when you were first eligible and then 1 year in February your doctor prescribes a $400 medication, you're going to have to wait nearly a year before you can get coverage, and you'll also pay a penalty to boot. Keep in mind that today there are some cancer medications which are taken orally, and these oral chemotherapy medications can cost hundreds of dollars per pill. We had a client who skipped Part D even though we had explained the risks to her. She was then diagnosed with cancer in late summer and her doctor prescribed oral chemo. She paid over $5,000 a month from September to December for her medication before we could get her into a drug plan the following January. And we considered her lucky because this happened toward the end of the year, just before that annual election period began, giving her that chance to enroll. Imagine if she had been diagnosed in February and had to cover the cost of that medication all year long. You won't want to pay these out of pocket for even 1 month, let alone 11 months. So in my opinion, that is one of the most compelling reasons to enroll and protect yourself. Now let's move on to how you can enroll in Part D. As I mentioned earlier, Medicare Part D drug plans are not offered by Medicare itself, so you won't sign up for Part D at the Social Security office. Instead, you'll enroll in a Part D plan offered by a private insurance company in the state where you live. There are 2 ways to participate in Part D. If you have original Medicare and or a Medigap plan that goes alongside it, you can set up a standalone Part D drug plan to go with that. Think of this as a pharmacy card. You present the card to your pharmacist whenever you're picking up a medication, and the pharmacist will collect your copay and then bill the Part D insurance company for the remainder. The other way to participate in Part D is to join a Medicare Advantage plan that has a built-in Part D drug plan. In this scenario, you'll have just one insurance card that you use at both your doctor's office and at the pharmacy. Medicare Advantage plans are the only type of plan that it can include a Part D. Medigap plans cannot, so if you like the idea of having both your medical and drug coverage rolled into one plan, you might consider a Medicare Advantage plan. Be sure to watch our video on the pros and cons of Medicare Advantage plans for additional information. The application process is pretty simple. You can enroll in a standalone Part D drug plan or a Medicare Advantage plan through Medicare's website or their toll-free line. You can also apply directly with the insurance company that's offering the plan that you want. Or if you want back-end coverage and support on your policy in case of problems or hiccups, you can enroll for free through a Medicare insurance broker like Boomer Benefits. Now, I should mention that not all agents offer Part D products. You'll find that some of our competitors right here on YouTube will not help you with Part D, and they'll send you to Medicare to enroll. This leaves you on your own to figure out any problems that might occur with that plan in the future. At Boomer Benefits, we do free annual help for Part D for any client who's enrolled in either a Medigap plan or an Advantage plan through our agency. All right, folks, so that's Part D. We talked about what Part D is, how and when to enroll, and how to avoid the late penalty. In our upcoming video, we'll go over how Medicare Part D works, including the 4 stages of Part D coverage, so that you can begin to understand what you can expect from your coverage. Now, if you're still new to Medicare and trying to figure out all this crazy stuff, we invite you to come on over to our website where you can read more about Part D and other Medicare-related insurance products. I'll put the link to our website below the video. And if you enjoyed this video, please subscribe to our channel so you'll always be notified when we drop a new video. We would love to have you. Thanks for watching, and we'll see you in the next video. Right now, you can enroll in an inexpensive plan so that you have coverage in case you need it.